Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Diagnosis. Diagnosis is done with the help of CT scan. Presence of fat is seen in the renal lesion. When there is presence of fat in the lesion, this will exclude the diagnosis of renal cell carcinoma. So always whenever fat is present in the uh, kidney, then always it is not renal cell carcinoma. So this will tell us that it can be angiomyolipoma. Lack of calcification is also important in angiomyolipoma. Then on ultrasonography, we will see presence of well circumscribed, highly echogenic lesion is seen, which is associated with shadowing. We can also do angiography. On angiography, you will see that there is presence of aneurysmal dilatation can be seen in 50% of angiomyolipomas. We see aneurysmal dilatation. Then if you do an immunofluorescence immunoreactivity, you will see that it is positive for HMB45. Immunoreactivity is seen for HMB45. So main important diagnosis can be done by CT scan. It is the diagnostic of angiomyolipoma.
thank you and thank you for watching.